If you want to know what is the best way to wean your dad off the ventilator after a transcatheter aortic valve replacement, stay tuned. I've got news for you. My name is Patrick Hutzel from intensivecarehotline.com, and I have another quick tip for families in intensive care today. So today I have an email from Rebecca who says, "Hi Patrick, how can I wean my dad off the ventilator after the transcatheter aortic valve replacement procedure? He has a neurological disease. The doctors estimate there's a 35% chance he will need a tracheostomy." So, Rebecca, I'm very sorry to hear about your dad's situation. It's very challenging. And I understand that you're looking for guidance on weaning him off the ventilator after his transcatheter aortic valve replacement procedure. So, as a general approach, it's essential to follow what the doctors are specifically recommending for your dad's care, especially when it comes to gradual reduction in ventilation support. The process of weaning typically involves reducing the level of ventilator support gradually. Usually, patients start off in a controlled ventilation mode, such as SIMV or ACV. And then it includes lowering the pressure supporting, it includes lowering oxygen levels, it includes lowering the PEEP sometimes, and then trying periods without the ventilator, which are called trials of the ventilator or spontaneous breathing trials. The goal is to see how your dad tolerates breathing on his own, monitoring for signs of fatigue, respiratory distress, or inadequate oxygenation. Now, that only can really happen if your dad is stable. So what do I mean by that? You know, if your dad is, for example, after the transcatheter aortic valve replacement, if he's bleeding, if he is in an irregular heart rhythm, if his blood pressure is low, or if his blood pressure is high, if he's potentially developed a tamponade, you know, if he's bleeding, then he won't be weaned off the ventilator. So I'm assuming he's stable, he's not on inotropes, he's not on vasopressors, then he should be able to be weaned off the ventilator. And there's a process when someone is weaned off the ventilator. You know, I've made a video a couple of years ago that are linked towards how to wean a critically ill patient off the ventilator and the breathing tube. I highly encourage you to check that out. Next, his respiratory status needs to be assessed. So the medical team and the nursing team will assess his breathing pattern, blood gas levels, especially oxygen and CO2, and how well his lungs are functioning on their own. Given his neurological disease, the doctors will also be watching his ability to clear secretions and his overall respiratory drive. Next, neurological considerations. Since your dad has a neurological condition, this complicates the weaning process, as his ability to protect his airway, maintain a normal respiratory drive, and manage his secretions might be impacted. The neurological disease might impact how quickly he can recover, so the team will likely be extra cautious. Tracheostomy decision. The doctor's estimating a 35% chance of him needing a tracheostomy. Likely consider the possibility of prolonged respiratory dependency, especially if he doesn't show enough progress or if his airway is at risk of obstruction. A tracheostomy would help provide long-term respiratory support if needed. The decision will be based on whether he's able to maintain adequate oxygen levels and clear secretions without the ventilator. Like I said, it will also be dependent on whether your dad is hemodynamically stable, whether there's no bleeding, no arrhythmias after the transcatheter aortic valve replacement. Next, multidisciplinary team, a team of specialists including pulmonologists, intensivists, neurologists, and respiratory therapists will likely be involved in the decision-making process. They'll work together to determine whether weaning is feasible and whether a tracheostomy is required. Next, monitor for signs of progress or setbacks. If there are signs of fatigue, difficulty breathing, or low oxygen levels, the weaning process may be slowed or paused. Conversely, if your dad is doing well without the ventilator, the team will continue to wean with gradual reduction. It's very important to keep managing your dad very closely while he's in ICU. The doctors and nurses need to do that and adjust the plan on his response and conditions. So, to summarize, wake up your dad. That's also very important. I didn't mention that. We wake him up, get him off sedation, get him off opiates or to minimizing as much as possible, because opiates can also have a sedative effect. So, and then get him off inotropes, get him off vasopressors, make sure there's no bleeding after surgery, right? And make sure he's hemodynamically stable, no vasopressors, no inotropes, he's not in an irregular heart rhythm. And then try and wake him up, and as soon as possible, get him out of bed, get him mobilized as soon as possible, with or without a tracheostomy, ideally, so he's not ending up with a pneumonia. You certainly don't want that. So I hope that helps and answers your question there, Rebecca. I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years in intensive care, and I've been consulting and advocating for families in intensive care since 2013 here at intensivecarehotline.com. And I can very confidently say that we have saved many lives with our consulting and advocacy. And we can do the same for you, because our advice is absolutely life-changing. And you can verify that on our testimonial section at intensivecarehotline.com, and you can verify it on our intensivecarehotline.com podcast, where we have done client interviews. And that's why we have helped hundreds and hundreds of members and clients over the years to improve their lives instantly, making sure they make informed decisions, have peace of mind, control, power, influence, making sure your loved one gets best care and treatment always. And that's why I do one-on-one consulting and advocacy over the phone, Zoom, Skype, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I talk to your families directly, and I handhold you through this once-in-a-lifetime situation that you simply cannot afford to get wrong. And when I talk to doctors and nurses directly, I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive. I also represent you in family meetings with intensive care teams. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. We also have a membership for families of critically ill patients in intensive care, and you can become a member if you go to intensivecarehotline.com. If you click on the membership link, or if you go to intensivecaresupport.org directly, in the membership you have access to me and my team 24 hours a day in the membership area and via email, and we answer all questions intensive care related. In the membership you also have exclusive access to 21 ebooks and 21 videos that I have personally written and recorded, making sure you make informed decisions, have peace of mind, control, power, and influence. Making sure your loved one gets best care and treatment always. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. If you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Like, comment, subscribe, and share the video with your friends and families. I also do a weekly YouTube live where I answer your questions live on the show. And you will get notification for the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my intensivecarehotline.com email newsletter at intensivecarehotline.com. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.